Thank you for clicking on this video, Minimizing Implant Risks. My name is Brett Royal with Implant. The benefits of cone beam CT have been well documented in many peer-reviewed articles. In most of these articles, they even go as far as offering recommendations of when to order a cone beam CT scan for dental implant surgery based upon potential risk factors. One area that many dentists feel very safe with is the lower first molar region when it appears, based on the panoramic and clinical findings, that adequate space and height is available. However, in the case that I am focusing on today, you will see how a simple or slam dunk case can be misleading and even lead to potentially life-threatening complications. If I don't have your attention yet, go ahead and Google perforate lingual cortex and images like this one will appear. This photo is an example of a case that was published in the Oral Surgery, Oral Medicine, and Oral Pathology Journal. Notice the severe hematoma of the tongue and floor of the mouth and the emergency tracheotomy. Obviously, not a good day for a patient or a doctor. I would like to thank General Dentist Dr. Jairo Chavez of Spring Branch Dental Care in Spring Branch, Texas, for submitting the following case and also for his candid interview. The patient is a healthy 34-year-old female. During her routine new patient exam, she expressed interest in replacing tooth number 30, which was extracted 14 years ago. Patient was very intrigued by the possibility of implant dentistry when the concept was first presented to her. Dr. Chavez, what is your initial thought of viewing the intraoral photo?
It looks pretty good. I have a good, 8-9 millimeters buccolingually there, and the space mesial, distal, I estimate about 13 millimeters. So I have plenty of bone, plenty of table there for me to place an implant.
And your diagnosis of the pano?
The pano shows that the mandibular canal is really low, and I don't even have any concern about any other structures. It's like, plenty of bone, and it just looks so easy. If I put an implant there that is going to be about, 11.5 or even a 13, I would be just fine.
Dr. Chavez, based on the overwhelming diagnostic evidence of the intraoral photographs and panoramic CT X-ray, why did you refer this patient to Implant for a cone beam CT X-ray?
My philosophy is the more data I get, the better diagnosis I'm going to do, and the better diagnosis, the better the outcome. Now we have the technology to know, and I'm not one of those people that think that ignorance is bliss. I think that knowing is way better. So I just want to know where I'm going to place my implants, and that's what I do. Once in a while I will feel very confident, and that's the problem. When you feel overconfident, you have the tendency to make mistakes.
How did you feel after you saw Impant's initial treatment plan using an 11.5 millimeter implant in the ideal restorative position based upon your initial recommendation?
Well, the first thing that I thought is, damn, I'm glad I didn't do it. Because I was thinking about placing a 13 millimeter there, or 11.5, and then when I looked at that, it's like, okay, well, maybe I don't have 13 millimeters. Maybe I have 10 if I'm in the lucky side. Thanks to me having all the images, I felt very confident, and things went super smooth during the surgery. I knew what I was doing, and when you know what you're doing, just things flow much easier. When you're guessing, you have that in the back of your head, that little thing saying, maybe I'm messing up, But when you have all the data, there's no room for insecurities, Just do it and do it right, and patients feel it and they know it. They know when you have certainty. They know when you are doubting. And they're not stupid, Patients are smart. This is the reason why we do the CAT scan, and this is why it was a great investment, no matter how much it was. I don't know, I don't care. This is the result. This is why you're paying for a little extra. This is why you want to know the data beforehand. If we hadn't had this, it would have been probably a disaster. And thanks to this, things are just great.